Hello and welcome students. I, Dr. Adil Patel, welcomes you for the discussion of the topic multiple dosage regimens. Now let us try to understand what is dosage regimen. So after single dose drug administration, the plasma drug level rises above and then falls below the minimum effective concentration, which is known as MEC, resulting in a decline in therapeutic effect. So after the administration of dose, initially the plasma drug level concentration rises, and after attaining the peak, it starts falling down. Now to treat chronic disease, multiple dosage or IV infusion regimens are used to maintain the plasma drug levels within the narrow limits of therapeutic window. What is therapeutic window? So the plasma drug concentration above the minimum effective concentration but below the minimum toxic concentration, which is also known as MTC. And this therapeutic window we have to achieve for optimal clinical effectiveness. So two levels of plasma drug concentration you are supposed to remember. One is minimum effective concentration, below which there will be no therapeutic action, and minimum toxic concentration, above which the patient may have serious consequences due to the side effects. Now, these drugs may include antibacterials, cardiotonics, anticonvulsants, hypoglycemics, antihypertensives, hormones, and many other drugs. Ideally, a dosage regimen is established for each drug to provide the correct plasma level without excessive fluctuation and drug accumulation outside the therapeutic window. So whenever we are designing the dosage regimen, whenever we are deciding the dose and the dosing frequency, our aim is to keep the plasma drug concentration within the therapeutic window. Any type of accumulation outside therapeutic window may lead to the dose related side effects. For certain drugs such as antibiotics, a desirable minimum effective concentration can be determined. So first we have to find out what is the MEC value for antibiotics, and then only we should start a particular treatment with respect to patient. Now for drugs that have a narrow therapeutic range, for example digoxin and phenytoin, there is a need to define the therapeutic minimum and maximum non-toxic plasma concentration. So there are some drugs where you find that the difference between the minimum effective concentration and the maximum toxic concentration is very low. So when we are dealing with this type of drugs, we have to be very careful because of a narrow therapeutic range. Now in calculating a multiple dose regimen, the desired or target plasma drug concentration must be related to a therapeutic response, and the multiple dose regimen must be designed to produce plasma concentrations within the therapeutic window. Now, one thing we have to remember when we are calculating a multiple dose regimen, so try to imagine a situation where a patient is having multiple disease and we are trying to diagnose and treat multiple disease at one particular point. So while handling such type of case, we have to be very careful because the minimum effective concentration we have to consider in terms of the response. Sometimes the theoretical minimum effective concentration may not match with the practical therapeutic response, so the adjustments we have to make based on the practical therapeutic responses. Now there are two main parameters that can be adjusted in developing a dosage regimen. The first factor is the size of the drug, or you can say the size of the dose, and small t, that is the frequency of drug administration. For example, the time interval between two doses. So these two factors play very important role. The overall quantity of drug to be administered, that is drug dose, and the time interval at which the various doses are administered. The very important concept while discussing the dosage regimen is drug accumulation. So as the name suggested, what is drug accumulation? It is the accumulation of drug into human body or into various tissues and organs, and this may have some serious health related consequences because the higher concentration of drug are potential to produce toxic effects. Now for calculation of multiple dose regimen, it is necessary to decide whether successive doses of drug will have any effect on the previous dose. The principle of superposition assumes that every doses of drug do not affect the pharmacokinetics of the subsequent doses. Again, you have to remember a theoretical scenario and the practical scenario. So when we are designing the dosage regimen, the theoretical scenario is that the current dose is not affecting the pharmacokinetics of the previous dose, but sometimes practically due to the slow clearance of drug, some amount of drug may be retained or may left inside the body, and while we are taking the new dose, unknowingly the dose accumulation or the drug accumulation takes place within different tissues and organs. So therefore the blood levels after the second, third or fifth dose or maybe nth dose will overlay or superimpose the blood level attained after n minus 1 dose. So subsequently, when small quantity of drug is retained inside the body, and when we keep on taking new doses, the overall level or the overall concentration of drug increases. After certain period of time, even though patient is taking the prescribed dose, the overall concentration of drug goes beyond the minimum toxic concentration, and even though patient is following the desired dosage regimen, there will be appearance of dose related toxic effects, and this phenomena is known as drug accumulation. The principle of superposition allows the pharmacokinetist to project the plasma drug concentration time curve of a drug after multiple consecutive doses based on the plasma drug concentration time curve obtained after a single dose. So on paper we are supposed to prepare a graph of plasma drug concentration versus time, and once we get values where the plasma drug concentration is below minimum effective concentration, then only we can design or we can prescribe the next dose to the patient. Now the basic assumption are that the drug is eliminated by first order kinetics, and that the pharmacokinetics of the drug after a single dose, that is the first dose, are not altered after taking multiple doses. The plasma drug concentrations after multiple doses may be predicted from the plasma drug concentrations obtained after a single dose. So as I said earlier, we need to prepare a graph of plasma drug concentration versus time, and based on this graph we should decide the dose and the dosing frequency. Now this particular graph would help you to understand how the dose accumulation takes place. So the very first type of curve is representing a single dose, a very first dose. So as you can see, the second dose is given while some amount of drug is still present in the body. So there is a drug accumulation, and subsequently with third, fourth, fifth and sixth dose, the accumulation of drug inside the body increases. So this will lead to toxic side effects at certain point, right? So this example represents simulated data which shows blood levels after administration of multiple doses and accumulation of blood levels when equal doses are given at equal time interval. So doses are given in equal quantity. The interval is also fixed, but just because body is unable to clear or excrete the entire amount of drug as we are thinking, the drug accumulation takes place. Now there are situations, however, in which the superposition principles does not apply. In this case, the pharmacokinetics of the drug change after multiple dosing due to various factors, including changing pathophysiology in the patient, saturation of a drug carrier system, enzyme induction, and enzyme inhibition. So because of all these factors, sometimes we have to prepare a dosage regimen with different dose and different dose intervals. Now drugs that follow non-linear pharmacokinetics generally do not have predictable plasma drug concentrations after multiple doses using the superposition principle. If the drug is administered at a fixed dose and a fixed dosage interval, it is the case with many multiple dose regimens, the amount of drug in the body will increase and then plateau to a mean plasma level higher than the peak plasma concentration obtained from the initial dose. So because of drug accumulation, the plateau is achieved above the minimum effective concentration, and because of that the patient will have a proper therapeutic response throughout the dosage regimen. Now when the second dose is given after a time interval shorter than the time required to completely eliminate the previous dose, the drug accumulation will occur in the body. In other words, the plasma concentrations following the second dose will be higher than corresponding plasma concentrations immediately following the first dose. However, if the second dose is given after a time interval longer than the time required to eliminate the previous dose, the drug will not accumulate. Now this equation shows that the drug accumulation measured with the capital R index depends on the elimination constant and the dosing interval and is independent of the dose. So capital R is C max, that is the maximum concentration of drug at infinite time, and Cn is equal to 1 max, that is the maximum concentration of drug in plasma after the first dose. And subsequently what you are seeing is the mathematical treatment to simplify the equation. And as you can see that the capital R, that is the drug accumulation index, is directly proportional to the elimination constant. Higher elimination constant will result in lower drug accumulation, and the lower elimination constant will result in higher drug accumulation. So both are inversely proportional to each other. Now this simulated plasma drug concentration time curves after IV infusion and oral multiple doses for a drug within elimination half-life of 4 hours and apparent volume of distribution of 10 liters shows that the IV infusion given at a rate of 25 mg per hour and the oral multiple doses are 200 mg every 8 hours, 300 mg every 12 hours and 600 mg every 24 hours. So this is how you can get a plasma level time curve when we are dealing with different dosage forms and different routes of administration. So that was all about the multiple dosage regimen. Please go through the video and let me know if you have any query or question. So thank you very much for watching this video. Stay safe and have a good day.